And so Holly's going to talk with you today about what are some of the financial resources for caregiving. And yeah, that's that. She's great.
Thanks. I do have one question before I start. How do I go through slides?
Oh, we'll do it for you.
So I go, that'll be our signal?
I thought you were volunteering to pay for all this.
It's me, surprise. So next time we're trying to get Oprah so that she'll do that for everybody. So as Mary said, my name's Holly McLaughlin. I work at the Area 10 Agency on Aging. So we cover all of Monroe and Owen counties. So just a little bit about me. I graduated from the IU School of Social Work. I went through the Medicare training through the Indiana Department of Insurance. That program is called SHIP, the State Health Insurance Assistance Program. I have been certified as a case manager through the Indiana Division of Aging. I have a certification in information and referral, but they all are the same thing. I'm trained to answer questions. So as I'm going through, if you guys have questions, just feel free to speak up or raise your hand. There's also the last page of the handout is room for you to write any questions if you want to save them till the end. But I do encourage you, if you have questions, to ask them to the whole group, because if it's something that you want to know more information about or need clarification about, then there's at least one other person in the room who feels the same way. So as caregivers, you are probably not surprised to learn that statistically, 94% of people have reported that they would rather stay home than move to an institution. And so all of the area agencies on aging, our goal is to help people and their caregivers find the resources and find the services that they need to achieve that goal. So here, first I listed the activities of daily living. If you've worked with healthcare professionals, they often will shorten that to ADLs. And it's these things, when your loved one is starting to need help with these things, that's when you all have stepped in as caregivers. Sometimes the natural support network, the family, the friends, we don't have the time required to help our loved ones with all of these, or we don't have necessarily the physical strength, the physical health required to help someone else take care of these needs. Or it could be a matter of your loved one has gotten to the point where they need professional skilled help, like they need home nursing that a family member or a friend or a neighbor isn't able to do. So one of the things that you all have probably noticed is that as caregivers, you'll start to see your loved one needing help with these things before your loved one is able to recognize that or admit that they need help. So part of your job as caregivers is to try and help people recognize that, and that's really difficult. And I think that's one place where professionals can really help you guys, is to help make that connection between helping your loved ones see that they have these needs. So the first thing that I'm going to say is there's lots and lots and lots of services available. I'm not going to be able to talk about all of them today because there are so many resources and it's kind of overwhelming. But I will say the next session, which is in 2 weeks, Liz Jones from Area 10 will talk more about different resources available. And today I'm going to focus on home-based services. So these are things like house cleaning, home health, and that can either be an aide, so someone that can help with bathing or dressing, or a nurse who can help with medication setup, or more skilled things such as giving shots, things like that. Personal emergency response buttons, companionship, and I think one thing that y'all need to remember as caregivers is it is completely valid, even if you are able to give all the care a person needs, it's completely valid to have professional help so that you can get out of the house and go to the movies. Respite care is something that all caregivers should have. Because if you are taking good care of yourself, then you're better able to take care of the person that you love also. So the first way that people pay for in-home services is self-pay. So a lot of people have pensions from their work. They have their nest egg that they've been saving up for retirement. And this is probably the first resource that people are going to use to start paying for in-home services. You have choices. There's different companies that you can hire to do this. You can also try and hire an individual to do this. The differences would be a company usually has a different type of insurance and bonding. So you work with the company does all of the background checks on their employees, they do a certain amount of training, and then they send those employees to your home. That is usually a little bit more expensive than if you directly hired an individual. So sometimes you'll see in the classified section of the newspaper, it's just an individual person soliciting for help. Usually those individuals are less expensive per hour, but you also have to do the work of checking the references, making sure that it's someone you're comfortable with, and if it turns out that that person, takes advantage of the situation, it would be then up to you to contact the police and work with the police and that sort of thing. And if that's something that you are considering doing, then again, the Area Agency on Aging is a great resource. I know Area 10, we keep a list of individuals that we've done a background check on, and they all have some background check before we refer them out to you guys. And then we also have a list of all of the local companies that you can hire as well. Another thing to consider if you are doing self-pay for in-home services is looking for ways to save money in your budget that you can then allocate for caregiving. So again, Area 10, and there's lots of other programs, organizations in our county area that have volunteer programs. So maybe instead of hiring someone to sit with your loved one while you go to the movies, you can connect with Area 10 and we'll look for a volunteer to come and sit with your loved one while you go to the movies. Or recently, Habitat for Humanity has started a program where they come in and do some home modification, and it's all on their dime, and that way some money that you have been saving for maybe widening the doorways in your home for wheelchair access, you can then spend that money on hiring professional caregivers. There's also lots and lots of programs through the federal and state government that you could apply for. SNAP stands for the Supplemental Nutrition Assistance Program, I think. But basically it's food stamps. So, instead of having this portion of your budget spent on groceries, you can make that a little smaller so you have some extra money. There's also different vouchers available through Area 10 that help pay for food. There's food pantries, so many food pantries in the Bloomington area, different places you can go for hot meals. Lifeline is a phone service, so even just the very basic phone service is getting really expensive nowadays. So this is a federal program where they pay for either a basic service landline or a basic service cell phone. These next two, the Medicare Savings Program and Extra Help, as well as Hoosier RX, these are all different programs that help pay for Medicare costs. And all of these programs and ways to apply for them are on that second sheet that I handed out. And then I also want to say about those two Medicare programs, talking with a SHIP counselor is a really great way to find out the current year's requirements, how to apply for them if you're eligible, because it can get confusing. And so I know I'm kind of biased because I'm a SHIP counselor, but it's a great program. The Energy Assistance Program helps pay for gas or electric bills. And then you can also, if moving out of the house that the person's in is an option, you can look at Section 8 housing vouchers or moving to a senior apartment, because both of those tend to be a little less expensive than paying full price rent or full price mortgage. Okay, so one thing that comes as kind of a surprise for most people is that Medicare does not pay for long-term care. I've detailed it out here as far as Medicare options. So option 1 or option 2, I'm not going to go into a lot of detail about them unless you guys want me to, but it basically comes down to they will pay for home care or nursing home care for a rehabilitation. So if someone falls and breaks their hip, then Medicare will pay for home health care for a certain amount of time while that person recovers. But if someone needs long-term support just to maintain their level of independence that they have now, Medicare is not going to be helpful in any way, shape, or form. Some people have chosen to buy these long-term care insurance policies. These are a contract that you have with a private company. Usually people purchase these long before they need them. So, but it's worth looking into to see if the person that you're caring for has bought one in the past, and maybe they don't remember that they bought it, or they're like, oh, I bought some kind of insurance sometime in the 70s and I don't even know where the paperwork is. Because these can often be really helpful. They're all different, so you would really need to look at the plan that the person has to see if it's helpful. They could cover nursing home care, care to come into your home, or adult daycare. Are you guys familiar with adult daycare?
I'd like to know more.
Okay, so adult daycare, it's a daytime service, so it's usually during business hours, where your loved one can go to a facility and they have meals and activities, and they spend the day there while you as the caregiver are able to then go to work or run errands, or again, go to the movies, whatever it is you need to do. One of the interesting and good programs we have here in Indiana is this long-term care partnership program. So because all of the different plans are so different, there's absolutely no standardization as far as what they cover or what prices or what the premiums are. Indiana started this partnership where if this policy meets certain minimum standards, it can be listed as part of this Indiana long-term care partnership. And it makes sure that the policy protects your assets, meets the minimum standard as far as how many days it covers and what services it covers. And it's just great because as consumers, you then have a shorter list of policies to investigate if you're thinking about buying one. Did you have a question? Okay. All right. Next, I'm going to be going over the Veterans Affairs benefits. The VA offers different things that are helpful. They offer health care. That's where you can go to the VA clinics or the VA hospital for care. They offer help with prescriptions. They offer a pension. And the one that I think I'll focus on is the aid and attendance. So these are the qualifications specifically for the pension. So I think what is interesting about this is even if a veteran has applied for the pension in the past and they've been denied because they didn't meet the disability requirement, once a veteran turns 65, then they're able to apply for the pension again because it's no longer connected with their disability. Does that make sense?
Yeah, but I've never heard.
So the pension, and then the aid and attendance, just to explain that one a little further. If you're getting the pension, you can get an additional amount of money, and it's called the aid and attendance benefit. And this is just for paying for a caregiver. And what I love about this program is that the person who gets it, can use it however they wish. So if they want to pay a family member, they can use it that way. If they want it to go towards their monthly fee for living in assisted living, they can choose to have it go that way. If they want to pay a company, they can have it go that way. It's really up to the person to spend it how they think is best for them, which is unique because a lot of them are really strict about where the money goes. All right, so next I'm going to cover Medicaid. So Medicare, that's the health insurance for anybody age 65 and up, or for some people under 65 with certain disabilities or health conditions. Medicaid is health insurance for people who have low incomes. You can definitely have both Medicare and Medicaid. They work really well as primary and secondary insurances for a person. Medicaid is also, unlike Medicare that doesn't cover long-term care, Medicaid does. They do this a couple of different ways. Most people who are living long-term in a nursing home are covered by Medicaid. And something that the social workers at nursing homes do is help people apply for that and work through that. They also have what they call prior authorization hours, or PA hours. And so if a person has Medicaid, their doctor can actually write a prescription for home health care. And it's pretty specific. It can only be like a home health, like a CNA, a home health aide, or a nurse who's doing skilled care. The income and asset limits for Medicaid are pretty strict. For this year, the income limit is $710, and what's the asset limit? $1,500 for an individual. And so a lot of people don't qualify for this until they've spent down their resources. So income is money coming in. That can be from Social Security, from your pension, from a trust fund, from Oprah. Whatever money you have coming in is your income. An asset is something of value that you own. And your house, for the most part, is not an asset. So if you're living in your home, that's your shelter. That is something you require, and these programs don't look at that as an asset.
So if your pension comes from a 401k or something like that, the remaining balance in that 401k is an asset or no?
Yes.
Yes.
Yes. So an asset, they're not going to look at your home. They're not going to look at the primary vehicle you use to get around. So basically, what they're looking for is they want to make sure that you've spent or liquidized whatever you can before they're going to help you pay for things. And it is really tricky. That's why there's so many lawyers that also market that they can help you with Medicaid planning. Because for different reasons, if you're looking at long-term care, you want to make sure that you are going to qualify for Medicaid when you need it. And a lot of people, they have built up this nest egg not to give it to a home health company or not to give it to a nursing home, but to pass it along to their families. And so working with one of those Medicaid planning legal folks, it's a way to make sure that all of your ducks are in a row before you actually need Medicaid. So basically, I think what it comes down to is Medicaid is tricky, but a lot of folks do end up needing Medicaid at some point. So let's say a person has Medicaid, they're getting the PA hours, but it's not enough. They're in their home. They're not able to do housekeeping to make sure their home is safe. They're at the point where it looks like they're going to need to move to a nursing home. Can I have the next slide? So that would be when a person would want to investigate the Medicaid waiver. HCBS stands for Home and Community-Based Services. And it's basically for someone who meets that level of care, so meets that level of need where they could live in a nursing home. But this program, they're able to use these services to stay at home as opposed to moving to a nursing home. And like I said, most people want to stay at home, so it meets that need. But also as taxpayers, if we're paying for Medicaid, it's less expensive to help someone stay at home rather than having them at a nursing home where they get 24-hour days, 7 days a week skilled care. These are the different types of waivers available. The top three I'm not going to talk about, mostly because I don't know anything about them. But the bottom three are the ones that apply to the population that we're talking about today, so older adults and people with physical disabilities. Money Follows the Person is a newer program, and this is for someone who's been doing rehab at a nursing home for 3 months or more, who wants to transition back home or back into an apartment, somewhere back out into the community. So Money Follows the Person is where that Medicaid money follows the person home and helps them be independent and be safe at home. These bottom two waivers are actually managed in our area by Area 10. Traumatic brain injury, so this is for someone who has had an accident or an illness past the age of 22 that has left them needing more care. And then the bottom one is the aging and disability waiver is what most of our folks would apply for. The aging and disability waiver, so a person has to meet the income and asset requirements for Medicaid, and they have to meet the level of need to move to a nursing home. But once they get this, there's really a lot of services available to them. They would have a case manager who would help set up all of the different services that they would need. They could have someone come in and do housekeeping. They could have someone come in and do personal care, the bathing, the dressing. Nurses can come in and do skilled care. This can also help pay for home modification. So a lot of people want to stay at home, but their homes just aren't safe for them because there's stairs or their doorways are this big. So it pays for home modification. It's just a really great service, and all of that is still less expensive than having someone live at a nursing home. So let's say a person doesn't have Medicaid. They still have income assets that prevent them from qualifying for Medicaid. There are some different other types of services. These programs are available to people. Choice is an Indiana program, and it's specifically for people who have applied for Medicaid and been denied. And again, it's the same types of services that allows a person to stay home and stay safe and independent. SSBG is the Social Services Block Grant. This is, again, state money to help people who don't necessarily meet that level of need. A lot of people who are getting SSBG are people who need help with housekeeping. That's probably the biggest request for SSBG funds. And then Title III refers to the Older Americans Act, and this is money that helps pay for a lot of people who get home delivered meals are getting that through Title III. But basically, all of these are just programs that would help a person stay at home. And the nice thing is that for the Medicaid waiver and all of these programs, if you apply through Area 10, the case manager that does your assessment would help you figure out which one of those funding sources would best suit your needs. So as Mary said, no matter where you are in the United States, there's an area agency on aging. This is Indiana, and it's nice because we just have one phone number. So if you dial this phone number from your county, you'll be connected with the nearest area agency on aging.